Okay, well, hello everyone. I welcome you to the webinar, the Bolsa Familia program, Access and Dissemination of Information. This is the first webinar of a series called The Brazilian Experience of Social Protection Programs. I can see that we have a lot of people that are connected already. It's a pleasure to welcome you to this webinar. I would like to invite you to chat your name, institution, and from where you are joining us in the chat bar at GoToWebinar. Okay. You also can ask questions to the speakers during this webinar, using the bar named questions at GoToWebinar as well, on or in the online space in socialprotection.org. How to guarantee information being delivered to about 14 million families? This is the main question that will be answered by our main presenter and discussing here. We are going to approach the major challenges to avoid misinformation and ensure access to rights to the beneficiary families of the Bolsa Familia program. And to speak about this webinar series, it's composed for 4 meetings, and it's a result of a partnership between the Brazil Learning Experience for a World Without Poverty, WWP, and socialprotection.org. WWP is a partnership between the United Nations, the World Bank, and the Brazilian government to document and disseminate Brazil's experience in fighting poverty. And socialprotection.org is an open, neutral, unbranded, and collaborative platform for sharing knowledge on social protection. So please feel absolutely free to send your questions, submit your questions through the GoWebinar chat bar or question bar, and also to use the Twitter and Facebook using /SPYourWebinar, okay? And please, we would like to invite you to register for www.socialprotection.org. As I said, it's an open platform for sharing knowledge, and to enjoy this. Let me introduce myself. My name is Luis Henrique Paiva. I am a researcher at the Institute for Applied Economic Research here in Brazil, and an associate researcher of the International Bolsa Center for Inclusive Growth. The National Secretary for the Bolsa Familia program between 2012 and 2015. As the main presenter today, we have Sibeli Comanetti. Sibeli Comanetti is the Communications Advisor for the Bolsa Familia program. And as our discussant today, we are going to have Antônio Clareca Filho, who is also a researcher at the Institute for Applied Economic Research and associate researcher of the International Policy Center for Inclusive Growth. What is interesting about the experience of Antônio Clareca is that he worked for the state government of Rio de Janeiro, where he was responsible for complementary conditional cash transfer that was conducted by the state government. So we will bring to this webinar the experience of someone who was responsible for a program that was operational at the subnational level. So I would like to give the word to Sibeli Comanetti. Please, Sibeli, feel free.
Good morning to everyone. It's a real pleasure to be here. I am I'm a technical analyst for social policies, and I work at the National Secretary of Citizenship which is an office of the Social and the Ministry of Social and Agrarian Development. In my presentation, I'll focus on social participation, social control, and strategies to communication with the families, the beneficiary families. We'll have a quick explanation about the Bolsa Familia program, its context, timeline regarding those three issues, our lines of actions, and if I have time, our challenges for the future. So we can start our presentation. Please, can you the three fronts of Bolsa Familia program. As you know, the Bolsa Familia program have three axes or three fronts. First one, of course, is the income transfer. The families with or without children receive the benefits. But to enter the program, which is focused on poverty and extremely poverty population, to enter this program, the families must have a maximum income of 170 reais per person, which is about nowadays $51, $52. The income transfer is supplementary, which means the families can and do work. The second front are the conditionalities, whose goal is to foster the use of social services, the access to social rights, and to interrupt the poverty cycle from one generation to another. In education, we monitor the school attendance for children and youths. In health, all infants under 6 years old must be vaccinated and have their growth monitored. And the mothers need to receive prenatal and postpartum care. X, or the third front, are the supplementary programs, which are most of them coordinated by the Plan of Brazil Without Extreme Poverty, and they also include state programs supplementing the income transfers, and beneficiaries are also considered one of the most important target groups for the unified social assistance system, or the unified social services systems. Some stats of Bolsa Familia, just to understand the size of the program in our country. Nowadays, we benefit 13.8 million families with an average income transfer of 161 reais, which is about $48. 48 million people are beneficiaries of the program, receiving the direct benefits. It means it represents 22% of Brazil's population. Twice a year, 9 million families are monitored regarding the healthy conditionalities, and every 2 months, 15 million students have their school attendance monitored. The annual cost of Bolsa Familia is 28 billion reais, which is about $8.7 million, about 0.5% of GDP, and it operates in all 5,570 municipalities. We have a very great array of alliances and strategic, both strategic and operational. In our ministry, we coordinate efforts with the National Secretary or the National Secretary of Social Assistance or Social Service, and this extraordinary office to overcome extreme poverty. They run and coordinate the entire unified social assistance systems and policies for the extreme poor. With the Federal Savings Bank, which we call here Caixa or SEF, we have a very, how can I say, very tight wedding because Caixa operates the payment of the benefits by a national network of bank branches, lottery houses, and others. And also it provides IT services. We have our partners in the education and in the health ministry, the ministries of education and health. They do coordinate and mobilize all the networks regarding schools, health unities, hospitals. They provide data, they collect and register in their own systems all the information about conditionalities. With the states and the federal district, we join forces to coordinate regional implementation and to train instructors that will multiply and disseminate information and train the municipalities the municipal workers. And finally, with the 5,570 municipalities, we have a very strong alliance because they are responsible for enrolling the families in the national unified registry for social programs, and also they offer the social services and collect data on conditionalities. Well, over the years, the Bolsa Familia program has strengthened its selection mechanisms and benefit payments to achieve a scale and automatization. After enrolling the Unified Registry for Social Programs, the families enter the program only if they meet the criteria. Then they will receive at home by mail a magnetic card which allows them to withdraw the monthly payments, and also they receive a very small brochure with the most important rules of the program. Despite this level of automatization, we, and of course the program acknowledges all the managers, users, and beneficiaries as stakeholders who must be heard, who need to be heard. And participation and social control are guaranteed constitutional rights. For us, social or grassroots control allows society to scrutinize the activities of government, especially those concerning public expenses. It's a form of accountability, it's a form of transparency, and for example, all the names of the beneficiaries and the payments, the values of the payments are publicized in the federal transparency website. Social participation, on the other hand, aims to promote the dialogue between society, between civil society and the government during the entire process of policy making. And access to information is related to both issues. After all, one can only participate in a debate or make propositions if one understands at least a little bit how the program, how the policy works. Information is also a right to the beneficiaries and a key instrument for the local workers to manage the program and to correctly guide the families. This is one of our main challenges in communication, making a complex policy such as Bolsa Familia understandable to all. It has been a challenge and it still remains. I prepared. For me, it was easier to recap the history of Bolsa Familia with a timeline. But of course, it's a little long, and I won't read everything. I'll just highlight some topics that I consider very important. I call these first years of Bolsa Familia as the structuring years, the years in which the legislative program, of course, was integrating various pre-existing programs, and the legislation regulated the principal topics, the principal issues of the program. One of them is social control. It's been considered important since the beginning, both in the law and the decree that regulates Bolsa Familia. Social control must be done in the municipal level by the creation, the installation of social control councils. MDS and access to information. MDS, the ministry, I call it MDS, created a call center and an ombudsman office in the early years. Beneficiaries start in 2006 to receive letters notifying with notification for not fulfilling the conditionalities. And also in 2006, we had regular transfers to state and municipalities to help them pay expenses incurred managing the program. I'm only mentioning that because it's directly linked to social control. After all this, the expense reports must be first submitted to the social control councils, and just 1 year later to the social assistance or social service councils, which are a more structured network. We also have, in the early years, started to send the beneficiaries messages printed in their payment reports. It's a very simple strategy and one of the most effective because we are sure that the beneficiaries get them. Finally, to end this slide, I need to highlight the Congress approval of the Information Access Law, which benchmarks transparency. Any person can ask for information about government affairs. It really made a change in how the public administration dealt with transparency, fostering active transparency. By 2012, for the first time, we had a specific budget for communicating with families, sending letters and communications. And on 2013, the ministry launched on the 10th anniversary of Bolsa Familia the official profiles on Facebook and Twitter. And on 2013, there was a very interesting move from the National Social Assistance Council or Social Service Council, passing a resolution establishing that the social control and social participation in the Bolsa Familia are responsibilities of all social services or social assistance councils. It's really important because it's a much more structured, a much more established, structured, and it's a way to make information disseminate information and to really gather this social, to institutionalize social control and participation. I think we also did a social focal group discussions with beneficiaries, revealing that communication letters and messages must be short, more to the point, and less technical. In other words, after many years, the beneficiaries just told us that we need to improve our communication by being simpler and by writing less. Last year, we had many topics to highlight. In a national forum of users, beneficiaries of social programs, and the unified social assistance system created. It orbits the National Council, and all the states in the federal district created similar forums. This is a direct consequence of a movement that gained force, that got stronger in the council with the representation of the users and the beneficiaries. In 2015, the Federal Savings Bank, the Bolsa Familia application for the smartphones. It was of course, the download is for everyone, but this application, this app, brings us important information about the benefit values. The methods are printed there, and of course you just have to have your identification number. If you are a beneficiary, you have this number and you can access your private information. For the rest of the public, you can only have public information about Bolsa Familia and how to enroll the unified registry. So in 2015, a national ad campaign reminded the Bolsa Familia beneficiaries to always read the message in their payment receipts. And I forgot to mention here, but I need to talk about it. Last year, also, the presidency launched a very interesting way of social participation, inviting all society to know more about the programs and to make suggestions on an online platform called Participa Brasil, which is Participate Brazil. Last year, our former secretary participated in a webinar just like that to discuss the results of this suggestion, this proposal. And it was a very interesting and pioneer experience. Finally, I think for this timeline, for the first time, the Vice President of the National Social Assistance Council is a representative of the users and beneficiaries. Recapping quickly our lines of actions, we have initiatives in social participation and social control, in information for communication for families, and in services. I didn't put it here in my presentation, but there is also something really interesting to address, that all the workers in the municipalities are a very important public for us. We have a specific newsletter to be sent. That is a weekly newsletter, and we send it to all our mailing list, including more than 16,000 names of people who work at the municipality's management department of Bolsa Familia, Unified Registry, and from in 11 years, we just sent more than 500 informative bulletins for them. And also we have SENAC has a very, very structured qualification system in which more than 35,000 people who interview the families and enrolled in insert the data in the unified registry were trained. In addition to that, more than 6,000 managers and technicians were also trained. Some numbers, I would like to show you some numbers about this initiatives in the next slide. The call center was created in 2003, and only last year 3.2 million calls were made. Well, we received 3.2 million calls, 96% of them regarding the Bolsa Familia or the Unified Red. 48 million calls and 740,000 emails from 2003 to 2015. 2015 received 17,500 requests, complaints, and questions. 85% of them regarding the Bolsa Familia and the Unified Registry. And the letters, our office, only in 2016, will send more than 8 million letters to not only the beneficiaries, but also the families who are enrolled in the Unified Registry. This initiative includes the families that do not fulfill conditionalities, but also need to update their information, their data in the Unified Registry. And Bolsa Familia application for a smartphone has already had 1.38 million downloads. Well, I thought I was going to run out of time, but I think I still have a little time to talk about our next challenges. We know that we are really aware that we accomplished a lot, but there's room to improve. There is a lot of room to improve, especially because we know, despite our efforts, this is a complex program and it's difficult to understand, especially by our public. We need to improve the way we communicate. We need to find alternative ways to communicate with families, to communicate with our partners, with the municipalities, and it's a work in progress, as I can say that. And one of the next challenges for the communication and information for families area is to investigate if the street-level bureaucrats are well trained and if they transmit correct information to the families. The result of this research may change our way to qualify the workers, to train the instructors, can help us to improve this our qualification strategies. We also want to produce a series of videos about the program designed especially for families, for beneficiary families, and for those who enroll the Unified Registry. Finally, to foster the dissemination of information about Bolsa Familia among our partners, this is one of our main challenges and that we need to address. It's very important that schools, health agents disseminate information, but it's work that needs to be to involve many actors. Regarding participation and social control, we can go to the next slide. Can we go to the next slide? Okay, regarding the participation and social control, we want to strengthen the council's members' contribution to the best functioning of the program in local level. We've already produced graphic material or instructions for them to understand what they can do to improve the program in local level, as monitoring, not monitoring, but at least to know who are the families that need to be that need special attention because they cannot fulfill conditionalities, and have a very direct and a very good dialogue with the management department. We also need to encourage beneficiaries to participate in the instance of social control, such as councils and other alternative ways of social control. And finally, for local teams and call center teams, there is a goal to have, we have a goal to help the municipalities improve. They serve our target groups, especially the poor, by establishing procedures and basic protocols. Finally, to create one of our challenges is to create more qualification opportunities for the Bolsa Familia unified registry local teams, and to perfect the periodic training of the ministry's call center staff. I really want to thank you the opportunity to participate in this webinar. This is one, I just put many website addresses so you can see our Charter of Public Services, the Bolsa Familia website, and our profiles on Facebook and on Twitter. I really enjoyed to participate in this webinar, and I hope you did as well. Thank you.
Okay, Sibeli, thank you. Thank you so much for your thorough presentation about the subject that we are considering in this session. And I would like to give the word to Antonio Claret from the studio. Please, Claret, feel free. Yeah, our main discussion today.
Thank you very much, Luis. Good morning, everybody, and good afternoon, everybody. It's a pleasure to be here. It's an honor to be in this session with Luis Enrique Spelli, which both of them have great experience in Bolsa Familia program. And I'm very happy to have the opportunity to bring some elements from the subnational perspective of this great challenge that is communicating about a program so huge, so complex as is Bolsa Familia. Sibeli's presentation showed, I think, quite well how are the different layers of communication that are necessary to achieve different publics, different audiences. We have the beneficiaries, around 14 million families, maybe 22-23% of Brazilian population. We have the intergovernmental staff in 5,500 municipalities, more than 170,000 workers in this network of professionals working in the implementation of Bolsa Familia and social systems in Brazil. We have the communication among sectors, mainly education, health, that also are related to Bolsa Familia. And also we have another dimension that is the general public and the media in general. Bolsa Familia is one of the most scrutinized programs in Brazil in terms of evaluation, but also in terms of public debate in the media, the newspapers, the television. All the days, every day, we have something about Bolsa Familia in our public debate in Brazil. And sometimes this information is not very well clarifying. It doesn't have a very clarifying role to the beneficiaries and even to the public opinion. So I would like to discuss a little bit very quickly the role of the state level in Bolsa Familia program and also our experience with our own program in Rio de Janeiro. The states have the responsibility of coordinating the implementation of Bolsa Familia in their territory, doing a role of coordination of the municipalities, because it's very difficult for the federal government to talk to 5,500 municipalities. At the state level plays this role of organizing the training process, organizing the technical assistance with all the support of the federal government. So we do this in Rio. We try to have a very close approach with the municipalities in terms of Bolsa Familia and Cadastro Único, and also in terms of the local programs. In 2011, with the launch of Brasil Sem Miséria, Brazil Without Extreme Poverty, Rio de Janeiro government launched its own program called Rio Sem Miséria. It was conceived to be aligned to Brasil Sem Miséria agenda. And one of maybe the flagship program of Rio Sem Miséria was Renda Melhor. Translating is to be better income. It's a state program integrated to Bolsa Familia that implemented some innovations in terms of the selection, the targeting of the beneficiary families. We use a presumptive income algorithm to define which families among the beneficiaries of Bolsa Familia would be in the situation of extreme poverty that in Rio de Janeiro case we established in 100 reais, a little higher than the federal poverty line. And we calculated the benefits in order to fill the gap of extreme poverty. So if a family with 4 people has, let's say, an income of 70 reais after receiving Bolsa Familia, the state would pay the difference between 70 and 100, that would be 13 times the number of people, persons in the families. In that case, it would be like 280 reais, 120 reais to this specific family. So with this program, we use it in our partnership with federal governments. The states has the possibility of using the Cadastro Único for selecting their beneficiaries, and also using the payment system of Bolsa Familia to make integrated payment. So we have a card that is the Bolsa Familia banking card that is shared with the state, and we have the identity, the visual identity of Bolsa Familia and the program, the local program, in this case, Renda Melhor, and the family goes to the same banking network and can withdraw the benefits at the same day using the same PIN. It's very useful for the family. It's much more easier than using another card and going another day to another place to receive the money. So it was implemented in a very fast scale process. In 2 years, we managed to include in Renda Melhor 280,000 families, more than 1 million persons, and this in all the municipalities of the state of Rio. In 91 municipalities, the only exception was the capital that has its own program, very simple. So we did this scale up in 2 years, and we are deeply in the federal strategy of active search. That is to find the families, the most vulnerable families that were not included in the Cadastro Único and in the social programs because of this. So it was a very intense work, and we managed to include 170,000 families in this period since Brazil's Area's launch. So the first challenge for us was to communicate the existence of the state-level program itself. As it is so well integrated to Bolsa Familia, maybe the family would not know why they are receiving another complement of the benefits, and also what are the specific rules of the program. So our main line of action was to strengthen the municipal capabilities. I think, as pointed very well also by Sibeli, a permanent challenge is to qualify the street-level bureaucrats and also the local managers to inform families correctly about. And there is a central role here for the centers, the reference centers of social assistance that we call in Brazil Centros de Referência de Assistência Social, CRAS. The teams that works in CRAS, they are responsible for this direct contact with the beneficiaries and can provide the better information to understand what are the real questions, the real problems of communication concerning the families, and to give them this information. To do so, they need to be well equipped, to have the instruments to make this happen. One of the main issues is training. So the training is a permanent process in Bolsa Familia management. Since the beginning, the federal government organizes the guidelines and the material for that, and the states, with the participation of the municipalities, the states coordinates the participation of the municipalities and do this process of capacitation, amplifying the work of the federal issue, besides training, is the disposal of information. And we delivered to the municipalities a management system of our local program, and melhor, that also brings the information concerning Cadastro Único and Bolsa Familia. So with the professional working at the class receives a family to give some orientation, some information for them, they can, with a very, very simple and straightforward query, to have the view of the information concerning the main needs of information of that family, such as the state of the benefit, it is blocked or suspended, or if it's okay, if there's a problem with conditionality, if there's a problem with the updating of the single registry. So it's a very useful form to empower the professionals that are in the field to give the best information to the families. And we also made some operational reports that we call comunicados operacionais, covering specific issues that would have some difficulty for the technical teams deal in their work with the families. Besides this main strategy of reinforcing the role of the municipal level professionals, we also developed some other ways of amplifying our communication skills. We have also, as the federal government, we have the list of our beneficiaries published every month at the internet. We have an ombudsman service for support in the Secretary of Social Assistance in Rio. We published some flyers and booklets that help to make the information available to the families, and we sent that information to the Center of Reference of the municipality in Rio. We had a media campaign during some time in radio and TV to communicate the beginning of the program and the objectives. And we also use what Sibeli mentioned as the payment receipt of Caixa. In this payment receipt, there is information specifying which amount of the benefit is of Bolsa Familia and which amount is due to Renda Melhor. It gives some more information to the families to know what the role of each program. And to specific groups or subgroups of beneficiaries, we developed some strategies. As, for instance, we have a component of Renda Melhor that is called Renda Melhor Jovem, that is directed to the young people that are in the high school. We incentivize the students enrolled at the state network of high schools to have a good performance and to keep going at school since the conclusion of high school. And they receive each year a deposit in a savings account that was tailored to the specificity of the program. And I won't talk about this because it's a very, very specific, I don't have so much time. But to say that we have to draw a specific strategy to communicate with these youngsters that will be beneficiaries of Renda Melhor Jovem. And then we established when they the program, when they apply to the program, they inform a great majority of them. It's a very interesting thing for us. They have cell phones, they use cell phones. And we could communicate specifically to them, to the specific case they have, using the SMS mechanism. And also Facebook that gives the opportunity of an interaction, not only of the managers of the program with the beneficiaries, but the beneficiaries among themselves. It's a very interesting way of creating a group of discussion among beneficiaries. And another specific strategy we use it, active search effort that was done to amplify was to organize meetings with some representative leaderships of specific groups, like our quilombolas, that is the communities of that are linked to our slavery time, people that runs from slavery and forms their own communities. They were some isolated for a lot of time, and we have some specificities of these groups, and we try to achieve them by means of having a more proximity with their leaderships that could amplify the need of find them, these families, and include them in the single registry, for instance. And as I'm running out of time, I'd just like to do two final comments here, and then we can also continue our talk after that in the debate. I think it's important to show that this communication process is very important, not only to inform the beneficiaries, but also to reinforce, to give more strength to the program itself. So if you want to have a strong social protection network, not only the beneficiaries should be informed, but they should be informed of their rights, not only in terms of maybe a certain bias of the communication related to the electoral process, but they have to be enfranchised with their rights to social protection. And when we talk about cash transfers, we're talking about the right to a minimum income, but we're also talking about the rights to access of services and to opportunities of social inclusion. And I think the point of the sustainability of this process is very important. We don't have to communicate only with our beneficiaries, but have to know how to communicate to our broader public. It's a matter of social debate, of public debate, and in Brazil knows exactly the dimension of Bolsa Familia in the public debate. We have to have our better thinking on how to communicate the gains the program brings not only to the families that are directly benefited, but also to the whole society in terms of inclusion, social cohesion, and also the capabilities that are being promoted when you guarantee the access to school, the access to feeding, the access to health services to a range of the population that has been for a long time being excluded of the development process in Brazil and maybe in some other places. I will stop here and I will let more maybe questions for the discussion. Thank you.
We had two insightful presentation and comment, and we are ready now to answer to some of your questions. All of your questions would be answered either here by us or by other ways. Okay, we were going to receive your answers anyway. I selected some of the questions that were asked already. And the first one was very interesting. I will ask Sibeli to answer. And if you want to compliment anything, feel free, please. This question was asked both by Efia Lugundo and Vinicius Ferreira, and it was about the combination of poor access to education, which is a common characteristic for this population, and all the question of how to communicate with them. What is the challenge related to language specifically? So, Sibeli, could you comment about this?
This is a very interesting question. Thank you, Vinicius and Afia. Well, I've already commented that we made some social focal groups discussions with beneficiary exactly to discuss how the beneficiaries understand what we were trying to communicate. And we weren't surprised, but this forced us to change our communication because we were talking in a very technical way. We are bureaucrats, and we needed to be simpler, much simpler. So first, we had this goal to try to explain all the rules of the program in one booklet, in one pamphlet, in one letter. It's impossible. This Bolsa Familia is a complex program, and the families do not understand its complexity, do not understand it completely, and they do not need to understand it completely. But we need to empower them to understand the principal rules, and especially things that we need to stress and we wanted to highlight is the way is to empower them and to make them more conscious of the rights they have. The right to access not only the minimum income, but the right to access social rights such as education and health care. So we decided, after these discussions, we decided to make the letters, the messages simpler with really simple words, simple phrases, less content, and really straight to the point. We need to help them know what to do in order or to maintain their benefits or to maintain their data updated. This is really important. This is one of our main goals in the communication process, to stress the necessity of maintaining all the information in the unified registry updated.
Okay, thank you very much, Sibeli. Mr. Davud from Iran asked about how health conditionalities have been monitored. And we will ask Khaled to answer this question.
Okay. Thank you, Mr. Davud. The conditionalities in Bolsa Familia are followed up by a very strong intersectoral coordination. We have the Ministry of Health in Brazil, and as we have a federation, we have 3 levels of governments working together in the main social policies, like social systems, like health, like education. In health, specifically, we have in each municipality, sorry, let's talk one step before. We have in Brazil the system, the unified health system, that is run in partnership and with specific responsibilities by the states, by the municipalities, and by the federal government. In the local level, in the municipalities, there are basic health strategy, basic attention that is called family health program or strategy of family health. It's a team of people, of professionals, including doctors, nurses, sometimes psychologists, dentists, and they are responsible for a set of people in a determined territory. One team can oversight, let's say, 1,000 families. These people has the communitary agents that are responsible also to follow up each family. They have a protocol that they have to follow, and in this protocol there are the conditionalities of Bolsa Familia, and also the basic unities, basic health unities, unidades básicas de saúde, where the family, for instance, the pregnant woman goes to do their prenatal exams and postnatal follow-up of families, and the vaccination of the families. So these teams have a protocol that is designed in partnership with the Ministry of Health and Ministry of Social Development, and we have informational systems to make this information centralized at the federal level to see which families are complying or not with the conditionalities. And one point important, also in health and in educational conditionalities, as in the case of Bolsa Familia, they don't have a punitive objective, punitive goal. They are perceived by the managers, the people responsible for the program, as flagships, as a signal of vulnerability. And so the social network have to make extra efforts to achieve these families that are not complying with the conditionalities for them to have their rights, and we're talking about the rights to health and the rights to education, guaranteed. So the first thing when a family doesn't comply with conditionalities is to make to strengthen the follow-up of these families by the social assistance network in partnership with the specific sectors, health and education. So it's a very, very complex system which has been improved for many years since the beginning of Bolsa Familia, and now it is very reliable. We have 2 moments each year. It's 2 times follow-up of this, let's say in a simpler way. 2 moments in which these conditionalities are verified at the health sector, and they give information for the federal government to see which families are complying or not, and then they are follow up in a more close way, as I have said before. It's a very complex issue. I don't know if I have given an answer in a short time, but I did my best.
Okay, Clara, thank you very much. We are going to answer 2 or 3 more questions, but all the other questions, as I said, are going to be answered in some way to you, okay? Stefan Sibeli asked us to give some examples of messages that we address to beneficiaries, and asked as well, I think that both of you can bring some insight about this. Do beneficiaries can see these benefits as a right? This is his second question. So about examples of messages, please feel free.
Okay, we have a very large array of messages. One of them, for example, is the necessity to update the data in the Unified Registry. The families, every year we have huge process to update the outdated family data information. These families are called to go to the municipal management and to the municipal level of the program and do another interview and confirm if their income remains the same or if something changed in their composition, such as someone left the family, if someone was born, if someone died, and all this information needs to be collected. So this is one of our main, this is probably the message that we send the most. But we also have, for example, messages regarding the protection from, for example, Zika virus. The pregnant women must use, can I say repellents? I really don't know the word in English. Must protect themselves from the Zika virus, from the mosquitoes, and we also send this kind of messages. And the letters of regarding conditionalities, we can notify the family about them if they didn't comply or fulfill any conditionalities. But we are really keen to highlight that they have the right to access the services. It's not a repression, or it's not to a punitive objective. On the contrary, it's something that we need to sensitize not only the families but also the governments, that these families must have special attention and must be priority for the educational and the health systems. And about the question if the beneficiaries see the benefits as a right, I have to say that we have 48 million people in a continental country. So we have beneficiaries who are really well, really aware of their rights of this, and see the Bolsa Familia program and the state programs as a right for them to have minimum income, so they can be more autonomous and look for better opportunities of work, of education, and to break this cycle that came from one generation to another. But also, and I think in all countries you can see that, a very asymmetrical access to information, and you still have families that who do not understand the basic rules of the program and still think that this is just some kind of help. Of course, this is our responsibility and our goal to disseminate disseminate information and make, if not all, but at least the most part of our beneficiary really empowered and conscious of their rights.
This is a small here. As Ben said, when you talk about continental countries with so huge number of beneficiaries, it varies a lot the level of consciousness, of understanding of the program and the understanding of rights. One thing that I think is interesting that comes from qualitative research is that a very expressive number of families, of women, perceives the money as a money that is directed to the well-being of their children. This is the money that they use to buy something for them to go to school, something they like to eat that they think would be good for them to have as in their meals. So it's interesting to see that sometimes they differentiate the benefits in terms of this, what we call maybe the long-term effects, the best stresses that is reinforcing the capacity of these children to go forward in the educational system and also in the social domain. So I think it's very challenging to know that, challenging to see how much they perceive this entitlement of rights. Bolsa Familia is a program created by law, so it has a certain degree of institutionalization. It's not like health that is defined in our constitution, but it has its strength, but it must be reinforced. I think that one of the main objectives of the communication strategies that have been run by the federal government is to reinforce this. It's very useful to see this improvement in the communication that was done in the last 2 years, that was also mentioned, to hear the beneficiaries in groups to see if the communication is achieving its objectives. So it's not about just talking or sending information. We must be open to see how this information is being received by the families, how they are processing this information, and how this is changing the way they understand the program, the way they understand their participation in the program, and their role as citizens in a society, the rights they have by being citizens in this specific society.
I would like to, we're going to I would like also to complement this answer by highlighting that the benefits and the program has had a very huge impact on women, especially when we talk about women that are historically in asymmetrical relationships. The program was able to empower women to, by this small amount of money, they feel recognized, they feel that their work, domestic work, is recognized, and they can break the submission level in their relations. And this is very important for them to be entitled and see the rights they have and the opportunities they have in society, in their families, and with their children.
Sorry about that. James asked us to talk a little bit about the interface between the national program, the Bolsa Familia program, and programs that were adopted in subnational levels, state and municipalities, some of them which predated the national program in 2003. Clara, could you give some insights about that?
Yes. Well, James, thank you for your question. Your question gives the opportunity of talking a little bit of the genesis of Bolsa Familia. Bolsa Familia, the cash transfer programs in Brazil began with municipal experiences. like Campinas, Belo Horizonte, Ribeirão Preto, and also Distrito Federal. They had programs in the style of Bolsa Escola program since 1995. And then they give to the federal government to implement class transfer programs. Beginning in 1996 with the program that eradication of child labor, and then with programs like Bolsa Escola, Bolsa Alimentação, and so on. So we have an interaction between the local level programs and the federal programs. So they began there, and they gain scale after that. The Bolsa Familia has in its design the possibility of integration of programs. The case I mentioned about Rio de Janeiro was followed by other places. There are municipality that is one of the maybe the most long-term program integrated to Bolsa Familia in a city that is very close to Belo Horizonte that you mentioned, that is Nova Lima. It is running together with Bolsa Familia since 2006, 10 years of payment of benefits, this integration of Bolsa Familia in the program, local program. So Bolsa Familia in its huge scale, maybe it gave the conditions of every family in every place in Brazil receive, provided they have the eligibility criteria, receive benefits that gives them conditions of a minimum standard of living. And the municipalities can join this effort by creating their own programs and associating, if they choose to, their programs to the federal program. It would be a challenge, of course, how to integrate a huge number of programs, and to have more than 5,000 municipalities. We can do this in a more organized way, I think, at the state scale. It's easier to talk to 25, 26, 27 subnational levels, subnational actors like these municipalities. But in some cases, some municipalities might maintain their programs even if not integrated to Bolsa Familia. It's something that I think it should be better studied in Brazil. We don't know exactly the number of municipalities that run their own programs. We just know the programs that are also integrated to Bolsa Familia. They are not so much. Maybe we can have better information about that. But I think one municipality is the capital of Amazonas, that's Manaus, that's running a program yet. With Bolsa Familia, Nova Lima, and I don't know if other municipalities are doing that. We have more states running programs integrated to Bolsa Familia than municipalities. I think this is an operational issue. It should be really very difficult to make this arrangement with such a big, huge number of entities like the municipalities in Brazil.
Okay, thank you very much, Paré. Concha Stata asked a very interesting questions about how court decisions have been affecting the program. Interesting question, Concha. I have to say that court decisions have been affecting much more older, if you will, older benefits, older social protection benefits than the most program. Certain types of social protection benefits in Brazil have 20% of their concessions made by courts. But this percentage so far in the Bolsa Familia program is negligible. So we haven't been affected by court decisions so far. We think that it can affect more the program with time, but so far the program has not been affected a lot by this kind of decision. Finally, we are coming to the end of this webinar. As I said, many questions, very interesting questions. All of them will be properly answered in a way or another. You can be sure about that. We had quite a lot of people in this webinar. It was a pleasure for us. And I would like to ask our main discussant and our presenter if they want to address our assistance in to making a conclusion walk.
Thank you very much for the opportunity. I was really nervous to speak in English and bring all this information and discuss all this information with you. I really hope you understand that we really need to strategies, our social control and social participation offers, and this is a work in progress. Are all in our office trying to make the best work we can do. And thank you so much. I hope you appreciated the presentation, and I hope you understood my accent. Thank you.
Well, I'd just like to thank all of you in the audience. It was really a communication process here. We have some time to talk and have also time, not so much that we would like to, but have time to hear from you, to have some opportunity of interacting with you. And we're so much interested in trying questions. And it was a pleasure to be here. I thank you that have time with us, and also to the organizers of socialprotection.org and WWP, and all my colleagues in this session. Thank you very much. It was really a pleasure.
Okay, just to finish, I would like to invite you again to register for www.socialprotection.org. Okay, and to thank you so much to be here today with us. It was a pleasure, and thank you guys a lot for being here with us today.
Thank you.